Hi, everybody, and welcome back to our discussion of epidemiology. And we're going to be considering, in a broad overview, the epidemiology of drug use disorders. First of all, we need to talk about the continuum of substance use, which ranges from the low end, from no use at all, to experimentation and social and recreational use, which accounts for most people who used illicit psychoactive substances, to the other end of the spectrum, which is people who experience mild, moderate, and severe substance use disorders, particularly dependence. This spectrum can be explained in part by this graphic, which talks about the pattern of use and the type of substance. The pattern of use implies that people are using the substance to get intoxicated. It implies that they're concentrating the dosage to get maximum effect. And it also implies the type of way that they ingest the substance, whether it is by smoking, whether it is intranasal, whether it is by injection. The type of substance makes a big difference too, because substances differ in their psychoactive properties as well as their dependence potential. And when you combine the type of substance and the pattern, you can begin to explain why different people using different drugs experience different types of problems, whether it's chronic diseases or accidents and injuries or social problems. And the three mechanisms that account for this is the extent to which the drug produces acute intoxication, whether the drug has toxic effect, usually based on chronic exposure, and whether the drug produces the syndrome of drug dependence, which we talked about in relation to alcohol just recently. Here's an example of a particular substance that has particular effects. Cocaine is a drug that's produced from a natural stimulant that comes from the coca leaf. It's ingested on a regular basis by agricultural workers in the Andes. But when it's refined into cocaine, its addictive properties increase substantially. And when it's further refined into crack cocaine, we get an example of a drug that is extremely reinforcing, but also extremely addictive, and can account for drug epidemics. Cocaine became widely available in North America in the 1970s. It then was transported through different distribution routes into Europe. And crack cocaine in particular became a major urban problem in its smokable and injectable forms in the United States in the 1980s, and subsequently Canada and Europe. So we can trace epidemics as they develop from the source within the producer countries into the consumer countries. Prevalence rates for lifetime use of cocaine are typically relatively low, and they're mainly concentrated along the trafficking routes and in urban areas. In Mexico City, the use of cocaine among high school students has been increasing with those distribution networks. Another type of drug which is very particular to certain populations is the use of volatile substances and inhalants. This comes in the form of sniffing liquids like gasoline, aerosol cans, and other types of volatile substances that people can get their hands-on, usually from industrial products. It occurs in all regions of the world, but it's particularly damaging to young children and adolescents in large urban areas where there are very poor living conditions. The health consequences can be quite profound in terms of the effects on the development of a young person's brain. Other substances which are being abused around the world are substances that have been developed for their therapeutic efficacy but have psychoactive effects. The psychoactive effects are reinforcing. People learn that they can get them from the legal market, and when that happens, they can abuse drugs that have been developed for therapeutic purposes, such as barbiturates, the tranquilizers, benzodiazepines, sedatives, and stimulant drugs. Epidemic patterns of illicit amphetamine use have been reported in a number of countries since the Second World War. In Japan in the 1950s, in the United States and Sweden in the 50s and 60s, in the United Kingdom in the 1960s. So what we see often is the development of a new substance, its distribution within society, for example, through the legal prescription system, and a gradual increase in the abuse, followed by changes in policies which then can reverse an epidemic. But epidemiology often plays a key role in helping to monitor the spread of an epidemic. And this is no less true of the epidemics that have been associated with the illicit production of a synthetic drug called methamphetamine, as well as MDMA and club drugs and opioid pain medications. So we have an example of epidemiology being able to use different types of indicators, often mortality statistics, in order to track an epidemic. Subsequently, we might incorporate and use survey methods in order to get a better idea of how a drug is being used within a population. Cannabis is a good example. Globally, cannabis is the most widespread illicit substance that's used around the world. By some estimates, almost 160 million people have used cannabis in their lifetime. The U.S. National Household Survey indicates that about 43% of the adult population has tried cannabis, and 13% have used used cannabis in the previous month. So it is quite prevalent within the general population of some industrialized societies. And it's used much less in developing countries. But the thing about cannabis is that the rates are generally higher in young adults, and that's true of many other drugs as well. Heroin use is a growing problem in several countries now, and it is a part of a new epidemic of both licit and illicit substances. Globally, there's been an increase in heroin production around the world, and during the 1960s, heroin, particularly injectable heroin, became prevalent in the United States. In the United Kingdom, we've had epidemics in the 1980s where cheap, pure, high-quality heroin was imported from Pakistan. We've had epidemics in Australia and other countries, and we've had reversal of these epidemics once they could be traced to their source. Other opioids have entered the picture in the United States, and this has led to increases in overdose deaths as well as the spread of HIV infection. The health risks associated with injectable drugs are quite significant, and in the prevalence rates of transmission of HIV infection have skyrocketed in countries like those found in Central Europe as a function of rapid changes in the economic situation. The reasons for the spread of injecting are complex, and epidemiology has helped us to understand this. It's often based on the availability of injectable drugs like methamphetamines or heroin. It depends on the location of the country or within the country, a city. In the routes, the transportation routes along rivers or highways. And drug injection becomes more prevalent in countries where there are former patterns of use to begin with, which were much less problematic, like in Southeast Asia, where opium smoking was quite prevalent, but it was never injected. Once more refined products became available and were imported back into the country or refined within the country, we get a rapid change in the pattern of substance use. That change has been associated with the spread of another epidemic, which is HIV infection. Currently, there are about 12 million people who inject drugs, and among them, almost 10% or a little bit more than 10% are living with HIV infection. But there are big differences among countries in terms of what proportion of the drug injecting population is infected. And the highest infection rates are in Eastern Europe, where it's almost 23%. In countries like the United States, where there have been substantial prevention measures initiated, the prevalence rates of HIV infection among drug users, injection drug users, is closer to 9%. The drug epidemic in the United States is in part a function of the availability of these drugs. And the opioid epidemic that we're currently experiencing is perhaps significantly associated with the overproduction of opioid pain medications. So in the US, where we only have less than 5% of the world population, we consume more than 50% of the world's morphine supply, over 80% of the oxycodone supply, a powerful opioid, and almost all of the hydrocodone supply. So for some reason, the US population is particularly prone to consuming opioid pain medications. And that may help to account for the high rates of overdose deaths that we're experiencing, not only for prescription drugs, but as people transition back and forth between the legal market for prescription medications and the illegal market for opioids, that we get a confluence of both the illicit market and the licit market. So here's a chart that shows the increase in overdose deaths in the United States and in the state of Connecticut, which has been quite studied and meets the classic epidemiological definition of an epidemic, increasing rates. And here's a chart that shows the number of prescriptions that have been prescribed during this period. There has been a recent reversal, and we can expect with greater limits on availability that there will be a reversal of the drug epidemic. What this indicates is that people tend to be distributing these drugs as a way of increasing access among their immediate social environment. So it's not as if the prescribed drugs are being stolen or diverted from the legal market. For the most part, these drugs are overprescribed and they're being taken from the legal market and then sold on the streets or just passed among friends. In summary, illicit drug use is endemic now in most developed countries, especially for cannabis products. Epidemic use, which is the rapidly increasing rate of consumption and problems, that takes place for some drugs and for some drug practices like injection drug use from time to time in many countries. Epidemiology helps us to track the endemic use as well as the epidemic use. And more recently, when you have psychoactive substances that are legal through a prescription system and psychoactive substances which are illegal on the illicit market, you get a confluence of these marketplaces where people are going into both markets and increasing the supply in order to fuel a drug epidemic.